We get a lot of questions when people are thinking about a subsequent pregnancy, wanting to know what good spacing is between first and second or second and third babies. So we thought we'd provide a short overview of what the evidence shows about pregnancy spacing.
And what do we call that? IPI.
Interpregnancy interval.
So if you're pregnant or postpartum and you like to get high quality, evidence-based information, subscribe below. We come out with new content every Wednesday. You can check our website out at www.shefoundhealth.ca. Now, make sure you read the medical disclaimer in the show notes below, and let's get going. So what is interpregnancy interval? Well, simply put, it's the time between birth and conception of the next pregnancy.
So what is considered a short or long interpregnancy interval? So anything less than 18 months, believe it or not, from birth to conception of a subsequent pregnancy is considered a short interpregnancy interval. This is because there have been some studies that have found adverse outcomes that we'll talk about more below in a pregnancy with an IPI or interpregnancy interval of less than 18 months. An interpregnancy interval of less than 6 months is most often associated with an adverse outcome. So 6 months from birth to conception of a subsequent pregnancy. A long interpregnancy interval is considered 60 months, which is greater than 5 years.
So what are some of the complications that we see with a short or long interpregnancy interval? So number one is maternal anemia, or low iron stores, which then contribute to low hemoglobin. So this is most significant in a short interpregnancy interval, simply because people have not had time to get their iron stores back up to pre-pregnancy rates or acceptable levels. So our babies use up all of our iron stores. And we actually have a great podcast by one of our local dietitians talking about how our babies use up iron and how we can get it more easily and effectively in pregnancy through natural sources like food and also supplements. So we'll link that below. But certainly our babies use up a lot because they need to get their stores up for the first 6 months of their life because they don't get much in the breast milk. So they use it all up. And then during delivery, we all have some blood loss. That's totally normal. But it means that we as women postpartum need to get our blood volume back up, and we need iron in which to do that. So maternal anemia is certainly worse with a shorter interpregnancy interval just because we haven't had the opportunity to get our stores of iron back up and therefore our hemoglobin back up to a normal acceptable level. The other thing that can happen with a short interpregnancy interval, which we'll talk a little bit more about below, is increased risk for placenta previa, which is when your placenta sits over your cervix, or increased risk for placental abruption, which is when it pulls away dramatically prior to giving birth.
The next complication that we can see is preterm birth. So we know that a short interpregnancy interval is a well-established risk factor for preterm birth, which we define as anything less than 37 weeks when baby's born. Now, it's the interpregnancy interval less than 6 months that's most associated with an increased risk of preterm birth. And then there's also what we call pre-prom. So that's preterm, pre-labor rupture of membranes. So that's when your waters break before labor, before 37 weeks. Big fancy words, right? So we know that about 25% of all preterm births are actually attributed to preterm, pre-labor rupture membranes, so pre-prom. And we've seen in a few studies that a short interpregnancy interval, between sort of 6 and 14 months and intervals even less than 18 months are associated with an increased risk of pre-prom, which then often leads to preterm birth.
So preeclampsia. Now, this is not actually increased with a short interpregnancy interval. What preeclampsia is, it's hypertension or high blood pressure as a result of your pregnancy. Not a pre-existing blood pressure, but simply resulting as your pregnancy. And this can cause significant medical issues in pregnancy for both mom and babe. So we try to avoid this if we can or decrease the risk of it. What is associated with an increased risk of preeclampsia is a long interpregnancy interval. So greater than 5 years between birth of your first to conception of the next pregnancy.
The next known risk factor is placental abruption. So like Alicia mentioned earlier, that's when, during pregnancy, the placenta can tear away from the wall of the uterus, which can cause bleeding and sometimes a bit of compromise to the fetus because we're not sure how much blood is flowing through the placenta to the baby. So data are a bit more limited about interpregnancy interval and the risk of abruption. But we've seen in some large cohort studies, meaning studies that have followed groups over time, interpregnancy intervals of less than 6 months are associated with an increased risk of placental abruption.
The next topic we want to talk about is low birth weight. So we describe low birth weight as a baby born at less than 2,500 grams. And that is when baby is term, so greater than 37 weeks. So this doesn't count for preterm deliveries, just a baby born at term, i.e. after 37 weeks that weighs less than 2,500 grams. And we know that there's an increased risk in women having a short IPI or interpregnancy interval. So there was about 10 studies looking at this, and they found that there was actually a 60% increase in the risk of having a baby of low birth weight if you had an interval of less than 6 months from birth to conception of your next pregnancy. And they compared this with women who had an pregnancy interval of 18 to 23 months. So 18 to 23 months from birth of one baby to conception of the next pregnancy.
There's also some other less common adverse outcomes. Placenta previa, like we mentioned, some birth defects or congenital abnormalities, and autism. For the literature has been really inconsistent, so we didn't think it was really relevant to include them in this discussion here today.
Another important thing to think about is mode of delivery. So if you had a cesarean section and you're hoping to have a trial of labor after cesarean section for a VBAC, vaginal birth after cesarean section, we want there to be an interval from delivery of one to delivery of the second during that VBAC of 18 months at least. Often our obstetricians won't recommend a trial of vaginal delivery after cesarean section if that interval is less than 18 months. So certainly if you're planning your second baby, you had a cesarean section with your first, and you really know you want to try for a vaginal delivery that second time, try to get that interval of greater than 18 months from birth of one to the birth of the next. So the big risk factor that we're worried about is what we call uterine rupture. So when that scar falls apart in labor. And so that's the increased risk. It's not a huge risk, but it is a very significant risk. So we actually have a YouTube video we'll link below on TOLAC to VBAC. So to try trial of labor after cesarean section to try to have a vaginal delivery after cesarean section.
So with all this being said, what is the optimal interpregnancy interval? So after a live term birth, meaning you gave birth to your baby at or around your due date, the World Health Organization recommends an interpregnancy interval somewhere between 2 to 5 years. This recommendation is really based on all the findings that we discussed above, knowing that an interpregnancy interval of less than 18 months is associated with an increased risk of poor perinatal outcomes after birth. And we know that an interpregnancy interval of 18 to 24 months is associated with the lowest relative risk. So anywhere after that 18 to 24 month mark is considered reasonable and safe to try and conceive again.
Now, these are general recommendations, and they certainly do not apply to every situation. For example, if you're 40 having your first baby, we know that fertility decreases dramatically when we become more wise, as Dr. Sarah and I are now.
Yes.
So you may just say, I don't care what it says, I'm just going to try and get pregnant right away, and that might be a very reasonable option for you. So these are general guidelines, and certainly having a discussion with your care provider around your particular situation is really important in every case. But
absolutely.
These are just kind of general information for you guys out there.
Yeah, and when you look at the risks associated with pregnancies with advancing maternal age, those risks may actually outweigh the risks of a shorter interpregnancy interval. So absolutely, we need to take this information and individualize it. So what about trying for a pregnancy after a miscarriage, a pregnancy termination, or stillbirth? Delaying conception after a miscarriage, there used to be this classic recommendation of at least 6 months or more. It does not improve pregnancy outcomes, and really we just counsel people to conceive when they feel ready. Sometimes we recommend waiting for at least one menstrual cycle, and that is simply for timing and dating purposes. It is important to note, however, that an interpregnancy interval of less than 7 months after a pregnancy lost can be associated with an increased risk for anxiety and depression in the next pregnancy. And it's really important to be aware of those risks so that you can protect yourself against it. We've got a podcast out all about how to treat and prevent peripartum anxiety and depression, and we'll link that in the show notes below.
Another really important thing is if you've had a loss, be that a miscarriage or a stillborn, it is so important to take the time to grieve that loss. Regardless of when it happened in your pregnancy, it is still a loss, and you lost a baby that you had dreams and aspirations for. And if we don't take the time to grieve that loss and to start to work through that process and move forward with that work going on, it's going to come back and get you later. And I think that's probably where that increased risk of mental health problems is if you have those short periods, because oftentimes people don't grieve the loss. They become pregnant again. They get excited for that new pregnancy. But then at some point, it does come back and it gets you. And if you don't take the time to grieve that loss, you will have to do that at some point.
So in summary, an interpregnancy interval of less than 6 months is most often associated with adverse outcomes. And these most common adverse outcomes include maternal anemia, so low iron, which can contribute to low hemoglobin, preterm birth, preterm pre-labor rupture of membranes, placental abruption, and low birth weight, so babies being born less than 2.5 kilograms or 2,500 grams at term. We also know that an interpregnancy interval of greater than 60 months, or 5 years, is considered a long interpregnancy interval and is associated with an increased risk of preeclampsia. The general recommended interpregnancy interval is about 18 to 24 months for the general population. But remember that this is not individualized in every situation. So an interpregnancy interval of 12 months may be totally reasonable and appropriate for women who are advanced maternal age, because like we talked about, you're balancing the risk of subfertility or what we know as pregnancies that can be higher risk with the risk of the adverse outcomes from a shorter interpregnancy interval. So these assessments should really be individualized. We know that after pregnancy loss, termination, or stillbirth, there is no specific time that you need to wait to try and conceive again, but that you should conceive when you feel ready and that you've taken the time to grieve that loss and reached out to your supports. We also know that after cesarean delivery, we need to counsel women about considering if they want a trial of labor after cesarean, and that there is an increased risk of uterine rupture if we have an interdelivery interval, like Dr. Alicia said, so from birth of 1 to next birth of less than 18 months.
So if you are trying to get pregnant or newly pregnant, we have a free tip sheet for what you need to do to kind of optimize your health. So make sure you check that out below. You can also check out our website at www.shefoundhealth.ca. We hope you found this information useful. Again, if you haven't yet, please subscribe. We'd really appreciate it. We also love feedback and information on what kind of information you want to learn about next. Have a great day.